One of the highlights is always late-breaking clinical trials, and really we've had some outstanding trials, some real surprises. The educational content, the scientific presentations are really outstanding, but I really like the late-breaking clinical trials. I just finished moderating a session where they're looking at novel ways to reduce lipid levels and prevent atherosclerosis. And the use of PCSK9 inhibitors seems to be providing a lot of utility. The cost is still an issue. There's RNA interference to reduce lipid levels, and they seem to be very successful. And they reduce lipid levels to far less than we have before. And there seems to be some good evidence that you actually see plaque regression. In the past, we've just tried to prevent progression of plaques. Now we're seeing to actually get rid of it. So I think the future is bright for the treatment of lipid disorders. Another one of my favorite trials was the ART trial. It was presented by Dr. Taggart a couple of days ago, looking at the utility of 2 intramammary artery grafts for bypass surgery versus 1. Now, the conventional wisdom is that multiple arterial grafts are much better than a single arterial graft. But at least in his study, at 5 years follow-up, there was no difference in the rate of death, myocardial infarction, stroke, quality of life, or need for repeat revascularization. So I asked him the reason for this. He thinks, well, both groups got excellent medical therapy and statin therapy, but I would expect some divergence of the curves at 5 years if there was a difference. So we're just going to have to wait for the 10-year results, and it comes out in 2018. But that was a big surprise. Another great trial was the Precision trial presented by Dr. Steve Misson. That looked at the effects of celecoxib, or a COX-2 selective inhibitor, versus naproxen and Motrin. And this is controversial because there's some evidence that all these drugs may increase the risk of cardiovascular events, especially COX-2 inhibitors. Now, the surprise in this trial was the celecoxib was actually less injurious than the others. Now, we can't really say that any of them were injurious because there was no placebo group. These were patients that had arthritis, either rheumatoid arthritis or osteoarthritis. So they got the maximum recommended dose for all 3 of these medications. But celecoxib did not seem to be any worse than these other 2 drugs. So that was kind of a surprise. And it kind of goes against what some other trials have demonstrated in the past.